The kind of lives that we lead today have an impact on the occurrence of these diseases. 1 in 7 adults in India today has diabetes.
1 in 7?
Yes, and 1 in 5 has hypertension. All of these, there will always be some degree of genetic component.
Okay.
They will have some hereditary component. But that doesn't mean that lifestyles are not making an impact on those diseases. Okay.
Hi, and welcome to NuMee's first podcast with a very good friend, Dr. Shailendra, who is a passionate medical doctor with a specialisation in public health and preventive medicine from St. John's Medical College, Bangalore, and a master's in management of international organizations from University of Geneva, Switzerland. So currently, Shailendra is serving as program director in Japaigo, India, and he leads multiple portfolios that impact lives of millions of people, focusing on non-communicable disease as one of the streams. He is also an avid reader, researcher, and has co-authored over 45 publications in reputed national and international medical journals, and several of them include non-communicable diseases. First, welcome to the podcast.
Thank you. Thank you very much for inviting me over and to giving me an opportunity to share some of these views about non-communicable diseases. And see, non-communicable diseases are those diseases that are not transmitted from one person to another, like your regular infectious disease, like a TB, like a COVID. Right. So non-communicable diseases are also called lifestyle diseases, right? And terms are used interchangeably, but specifically non-communicable diseases are categorized into different varieties. Like there can be heart diseases, there can be diabetes, hypertension, there could be cancers, there are respiratory diseases, and so on and so forth.
Why are they called lifestyle diseases?
Yeah, so see, all these lifestyle diseases are called so because they are caused because of our lifestyle choices. The kind of lives that we lead today have an impact on the occurrence of these diseases.
For example?
For example, physical activity. If you're not physically active, it can lead to overweight, obesity. It can lead to a non-communicable disease or a group of non-communicable diseases, right? Lifestyle diseases. Now, when we look at overall lifestyle diseases, there are a bunch of risk factors. We call them as risk factors, which lead to these lifestyle diseases, right? So, risk physical factors. Activity, inactivity, physical inactivity, poor, unhealthy dietary practices. If we eat stuff which are not healthy, right? Then you look at sleep being, less sleep, disturbed sleep. If the person has dependency on tobacco, consumes tobacco, alcohol, limitless consumption of alcohol, all of this.
Screen time?
Absolutely. A mobile screen time, TV.
You mentioned sleep, so I thought screen
time.
Yeah.
And then pollution, the regular air pollution, environmental pollution, water pollution, all of those can also lead to a lot of lifestyle diseases.
So these risks increase our risk of catching or getting one of these lifestyle diseases.
See, when you look at our day-to-day life today, right? What do? We are all, if you look at a typical middle-class guy or a girl, our lives are very dependent on our work, the stresses of work, right? We all have sedentary lifestyle. We all largely sedentary lifestyle. All of these have led to an increase in the lifestyle diseases.
When you say increase in lifestyle diseases, what were the numbers, or where are we heading? What do you mean by that?
Well, actually, if I tell those numbers, right, sometimes people do get scared. But the idea is not to scare people away, to really bring attention to the problem that we are dealing right now. So if you look at adult population of, let's say, 15 to 50 years, which is the most productive period of a human being's life, right? So if you just compile all these people together, 1 in 7 adults in India today has diabetes.
1 in 7?
Yes, and 1 in 5 has hypertension. right? Which means increase in blood sugar in your blood and increase in the blood pressure of your in your body, right? So that is what is the number that we are looking at. Obesity, overweight are much higher than this. Nobody is really recording how many people have sleep disturbances, right? All of these diseases, risk factors, they're all causing a cluster of, or what I call as an unhealthy decoction, right? Which is what is leading to increase in lifestyle diseases.
But there is a thought that some of these diseases are genetic and are not lifestyle diseases. Is that how true is that? Or
so all diseases will have a minor genetic component, right? And I'm not talking about the genetic disorders, right? There are a group of disorders called the genetic disorders. But these diseases like your heart disease or, chronic obstructive pulmonary disease, what we call as respiratory diseases. You look at diabetes, hypertension, all of these, there will always be some degree of genetic component. They will have some hereditary component. But that doesn't mean that lifestyles are not making an impact on those diseases, right? In fact, Indians in general are known to have or get these diseases almost a decade earlier than the Western population. And that is a genetic, that's a genetic component, right? But that doesn't mean that these are not affected or increased by lifestyle factors. And that's what is happening today. The last 20 years, when you look at if you're looking at the prevalence or occurrence of the risk factors, they have increased. And consequence of that is that the diseases have increased, right? And these are all these are all slow epidemics, which means that the risk factors may occur much earlier in our life and the diseases will occur much later in the life, right?
Okay.
And that is where the the problems are. Also, many times you may not even know that you have a lifestyle disease, right? So, for example, an individual might have diabetes for 10 years, 15 years before he actually getting to know that he has diabetes, right? That may so happen that the person comes to us as medical practitioners with maybe a blind, maybe a visual defect or even blindness in some cases or a hearing problem, right? And then when we look at, okay, what is the problem here? We detect that, okay, this person's blood pressure is high or blood sugar is high.
So till then, no checks have been done.
It is very much a possibility, right? And if somebody has cough or cold, right, or a fever or, any of the infectious disease, usually that inhibits or prohibits that person to go out and work, right? He falls sick, right? You get fever, you're tired to go out, you have fatigue, you lie down. And therefore, you are able to go to a doctor immediately or as quickly as possible. But with diabetes, hypertension...
Because the symptoms are visible and are seen in those cases.
Correct. In this case, it is not. Right? It will take many years before the symptoms really come up and pick up. And therefore, one of the things that people must do is to keep checking for measuring the blood pressure, measuring blood sugar once in a way, proactive.
Okay.
That is what should happen.
So, we have lifestyle causing a lot of increasing lifestyle diseases. What is your take or advice in terms of addressing these lifestyle diseases?
Yeah, I mean, it's funny that we are talking about lifestyle diseases today. And the father of our nation, Mahatma Gandhi actually wrote about it about 100 years ago. 100 years ago. Right? And I just wrote it down because the quotation seems really very powerful and very interesting. So let me read that out. So Gandhiji says, instead of using the body as temple of God, we use it as vehicles for indulgences and are not ashamed to run to medical men for help. It actually summarizes very beautifully the neglect of prevention, the indulgence in excesses, and lastly, seeking medical assistance to cure disease. You see, many years ago, I had written a paper, the topic of which was, disease is a priority, health is not.
Disease is a priority.
Yes, people always go to a doctor when there is a disease, right? That is a priority for them. They don't come to a doctor when they are healthy. Nobody goes to a doctor when they are healthy, right? So therefore, the responsibility of going towards a healthy lifestyle rests with you and me,
with us.
Right? And so it is me who has to take steps in order to ensure that my lifestyle is in a particular manner, is healthy, and therefore we are able to drive towards a more higher level of health. So the short answer to the question is, it's I who has to take the step forward with respect to lifestyle diseases.
So some tips, what can I do in terms of making sure I develop or inculcate some good habits into my lifestyle or routine?
So I'm sure this is not rocket science to understand that that the following few components need to become a part of our life, right? So one is being physically active, right? A few years ago, actually, there was a paper cutout in which on one side there was a cigarette and a cigarette which was burning, and the other side there was a chair which was kept. And the relationship was that it's as bad if you're completely sedentary, sitting on a chair all through the day, vis-a-vis smoking a cigarette, which is absolutely true. So physical activity, being physically active, being mobile as much as possible, integrating physical activity into your regular life, right? Going up the stairs, not using escalator, walking, as much as possible, avoiding, immobility, if I were to say. I think that makes a big difference, right? Pick up a sport, go swim, pick up maybe tennis, maybe table tennis, whatever, right? Whatever makes you interested. Not many people are, comfortable to just go and do exercise all by themselves, right? And so it is always good to have this idea of what is it that suits me as an individual and pick up that. I think that makes a big difference. So physical activity is one, definitely important. The second one is, of course, a healthy diet, right?
Yes.
Majority of the problem related to overweight and obesity is because of unhealthy diet, right? And what does that mean? What is unhealthy? It's very easy for me to say healthy, unhealthy. But healthy would be, fruits, vegetables, green leafy vegetables as much as possible, boiled food.
Not processed, probably.
Unprocessed food, right? Eating out regularly is a huge problem, right? And we all
in nowadays rather than
it's a trend, right?
Yeah.
You take a photograph of a food, you put it on Insta, and that becomes that's become a big rage. So eating as much as possible home cooked food.
Sugar.
Avoiding sugar. I think sugar is one of the single most important bad food available. Although we all have sweet tooth, I love sweets. But that's the reality, right? And sometimes I feel as a doctor, I do, give a lot of advice to a lot of people with respect to all these lifestyle choices that we make. But it's very hard to adhere to them, to align with a certain lifestyle. And I sometimes feel that whatever effort that we put in now, we can possibly relapse into the unhealthy behavior, unhealthy choices very quickly. So one good way of doing this is always in groups and peers, right? Have 3 or 4 friends together and you're able to do something like this. It makes a difference.
Or even one step at a time, right? Small goals.
Absolutely. Absolutely.
Keep focusing on the progress, because I think what most of us want is immediate results.
Correct.
And lifestyle choices or health is not a quick fix.
Correct. So absolutely. Yeah. And it is a slow and a steady process that need to be put in place in order to achieve long-term goals. I think that's the point here. The third one is sleep. I think it's very important, and people just, including me at times, right? We all travel quite a bit. We all watch TV shows. Nowadays, there's a lot of web series, OTTs on your mobile.
Before you go to bed.
Correct. Right. Good. So sleep, I think getting a healthy 8 to 9 hours of good sleep, sound sleep is very important. Tobacco, hugely problematic risk factor. Very well documented now. It leads to lots of problems, and yet you have many people who are dependent on tobacco, who are addicted to tobacco. So avoiding tobacco in all its forms. People smoke tobacco, they chew tobacco, they make it into powder and snuff it. So all these things, right, is a big problem, and therefore no. Alcohol, there's a lot of evidence against alcohol with respect to lifestyle choices, but there are also some research articles which talk about limited consumption of alcohol may not have a problem, in fact might even be beneficial to the heart, and there is evidence for that as well. So that is the other component. what I've observed recently, especially in urban areas, is the lack of connects with people. Social isolation.
Yes.
You're busy in work. You have hardly any time to go out, mingle with friends.
We're all connected digitally rather than in person these days.
Yeah.
Which is
Everything is just a phone call away, right? It's not a knock
but
away.
nobody calls. It's more of text messaging these days.
Or on WhatsApp, right?
WhatsApp,
That's what happens.
Yeah.
So I think that personal connect, friends, family, meeting
Social.
people, talking to each other. You have in urban spaces, a large number of people live in apartment complexes, right? Good associations with people, forming a community of sorts, which is proactively going to go ahead and improve their own life. I think that's very, very important. And this concept is actually called being aware of wellness, right? Ancient times, wellness was a integrated part of one's life, right? If you look at our sages, our ancestors, they were all very aware of these lifestyle choices that they were making, and therefore being well and wanting to improve their health was integrated into their life.
Probably the way I look at it was maybe life was simpler then. Right? There were less desires or distractions. You had a set routine, which included all of these good lifestyle choices already in it. Now, we see buckets of chips everywhere we go. We see cakes and pastries. So there goes our diet and there goes salt and sugar intake. And we have digital media and social media or addiction to phones and
that's why it takes a lot more effort now to integrate these healthier lifestyle choices into our lives, right? And that's why I mentioned about these 5-6 points. Then there are, of course, a few more things that
keep our mind active.
Learning, right? How much are we putting an effort to solve a problem, be creative? Very difficult. As a child, you would paint, draw. Those are all creative activities, right?
Now we scroll,
exactly, right? Solve a Sudoku, solve a problem, solve a crossword. I think those are all very good habits. Keeps your, mental frame much stronger and much active. And that makes a big difference. And then if you're up to it, finding some higher calling, some kind of meaning and purpose in life is always going to drive you towards that, right? And I think that kind of connects you to have a spiritual engagement with your own self, right? And I think that's also very helpful. It's been helpful to me, and I'm sure a lot of people have benefited from it as well. So I think these are some of the very critical, important and small lifestyle changes, but may have very, very strong and large, long-term impact. That's what I think, Kanchan.
Thank you so much, Shailendra.
Most welcome.
For helping us understand what lifestyle diseases are and what we can do to make a change in our life to have a healthier, happier life. Thank you.
Thank you.
Thanks.